2018, I was involved in a car accident, a really bad car accident. My car flipped 3 times, and I was lucky to walk out of the car unharmed. And then a good Samaritan, because I was really like out of it, I was disorganized, I couldn't figure out where I was, I couldn't find my phone. So a good Samaritan found my GHC card, my identity card in the car, and he called GHC, I think it was Nana on the card, and told her what had happened. By the time I was reaching the hospital, I found 2 alarms waiting for me at the hospital that had already mobilized. I think it was like 02 in the middle of the night. I remember breaking down, seeing them. I was crying. They were telling doctors what to do. They stayed there until my family actually came. So in that instant, I realized like it was more than just a network. It was a family. They cared about me, and we had built this bond over the years, which I was really grateful for.
My mother, interestingly, told me about Global Health Corps because she works for like one of our placement organizations. So she told me she had seen a very fun, intelligent, goal-getters in her organization, and she told me they come from Global Health Corps, and she asked me to look into it. So I looked into it, and I decided to apply.
The fellowship year and the experience of working in the SRH field opened so many doors for me professionally.
I've had so many speaking opportunities through GHC, and it gives me that courage to stand up in front of diverse groups and people from different cultures, just speak in front of them confidently.
I cannot count the number of times that during a meeting or even job interview, because I have put my GHC fellowship journey on my CV, and when they noticed the Global Health Corps, amidst all the other qualifications, all the other work experience that I have, GHC stands out.
GHC believes that people from diverse backgrounds, you don't necessarily have to have a public health background in order to contribute positively to the global health space.
GHC prioritizes putting young people in spaces where they can influence, they can make impact in their community.
When you're actually on the ground in frontline organizations like my company, you start to go back to those lessons and to start to see how you can use them in terms of growing yourself and growing your team as well. I've not just grown as myself, but I've helped other people grow by using those lessons that I've learned from GHC.
So I found leading from behind really effective in the sense that we would work within the community structures, work in the background, and let the community take leadership and ownership of the process.
We need skilled, workforce that can go into the health space, health systems, make sustainable change in the health system. And with that comes, somebody needs to invest in that, make sure that people are getting the training, they're getting the opportunities.
But I think in the work that we do, we also feel tremendously optimistic. We work with incredibly young people on a daily basis, and the reason that energizes us is we see that future, we see that potential, and we truly believe that if we can invest in people today, that we can have a significantly better world tomorrow.
From my cohort from 2016, 2017, we were a cohort of about 11 Zambians and 11 Americans. Of the 11 Zambians, 8 of them went on to continue working with the organizations that they were placed with for 1 year. So post the 1-year fellowship, they continued. And out of the 8, 5 are still with the placement organizations years later. So that just shows how impactful fellows are within the placement organizations and how these organizations value the input and contribution of the fellows that are placed with them.
Fellowship is designed in a way that just builds your skills, builds your network, but also builds your self-belief. Just understanding that, I can go into any room and not feel intimidated.
In my work today, it's helped me to know how to manage relationships, how to manage cross-cultural relationships, how to lead with empathy and understanding, and all of that is pretty much what I picked up during the fellowship year.
GHC is no longer just a network, but it's a movement. It's a group of young people focused on one goal. And we have now been embedded with so much knowledge that we have a clear path of where we need to be.
Speaking towards the leadership development teachings that we have for our fellows and who go on to be alums, our alums are heavily engaged through their national strategies. National strategies are basically ideas that the community comes together and centers around. It could be focused around SRH or mentorship within school children, which are some of the national strategies that are being engaged in with our alumni community.
The biggest takeaway I had from the GHC Fellowship was that sense of community and that support system. You know, trying to solve really large challenges, whether it's access to cervical cancer or in the work we're doing today, increasing access to students to healthcare. It's, you know, these are big problems and you know, oftentimes that can feel overwhelming. And I feel like the support in the community that, you know, was provided through GHC and that I continue to tap in today.
The GHC network has been a very resourceful space for me. It's been a backbone for me. It's helped me to stand strong on both a professional and personal level. There's so many resources across the countries and even resources with expertise.
When you get stuck with a work task and you know you've never done something before, and contrary to popular belief, not everything can be found on Google. So it's just a great resource to tap into, and where you can have, you know, someone who's willing to assist you.
The concept of community, there's such an amazing sense of community within the GHC community. I cannot begin to count the number of times I have been assisted by my community members. The slogan, once a GHC fellow, always, is not just a slogan. It really is what it is.